about COVID-19 now. A call this afternoon from the SA Committee of Medical Deans that employers of medical workers should consider compulsory vaccinations against COVID-19 for all health workers and for all medical students. The organisation says vaccinations have been shown to work to protect people. Professor Tiaan Dr Jager is the chair of the South African Committee of Medical Deans. He's also Dean of the Faculty of Health Sciences at the University of Pretoria. Professor Dr Jager, good afternoon to you and thank you for your time. What are you recommending?
Good afternoon, Stephen, and thank you for the opportunity. Yes, the Committee of Medical Deans in South Africa, together with the South African Committee of Dental Deans, are really concerned about the low uptake of that vaccination. And we think that it is necessary for all healthcare workers, students on the clinical training platforms, to be vaccinated. The vaccines have been shown to be safe and to be effective, and there's no reason to expose somebody or to put anybody at risk.
So if someone is working as a health worker and is not prepared to have the vaccine, do you have a recommendation as to what should happen next?
Stephen, it will depend on the setting. One would try to manage the situation. But I think, as a healthcare worker, we understand the basics of science. It is about health. So there's not really a reason not to be vaccinated. The evidence should be clear, especially from those people that's been fighting this pandemic on the front line. They experienced it, and we need to protect them and to make sure that we win this battle and not expose our patients or put them at risk. So it will have to be managed in a specific setting, and I'm sure there's various ways to do that. But for those people that's active on the clinical training platform and in contact with patients, we would really recommend to be vaccinated.
I suppose, it's health workers who are vaccinating people against COVID-19. It would be quite strange to vaccinate someone, to inject someone with something that you refuse to be vaccinated by yourself.
Absolutely. And the concept of vaccinations is not new. We all had the polio vaccine when we were small. The healthcare workers and the medical students get various vaccines to protect themselves against different diseases, and it's never been an issue. So, unfortunately, with COVID, this became out of control. And there's really, I would like to emphasize, no reason to be concerned. These vaccines have been tested. It's drug development that's been known to us for decades, and that's where work took place over a long period of time. So there's no reason to be concerned. And we've seen the statistics, the data, the impact of the vaccination, and it is effective. And therefore, we just need to make sure that we all do the responsible thing.
You've also made a recommendation, speaking on behalf of your organization, that people who've had the Johnson & Johnson vaccine, particularly, again, healthcare workers, that there should be some kind of booster shot. Let me just say, before you answer, that I'm one of those who's not a healthcare worker, but have the Johnson & Johnson vaccine. Why are you recommending a booster?
I think it's been shown that it will be more effective. It will enhance the effectiveness in terms of the immune response. And because these people are at high risk, we need to make sure that we obtain an ultimate immune response. So you would know that with the Pfizer, there's 2 doses, and the same concept here. But J&J is busy developing a second vaccine as a booster, and hopefully that will become available soon. But we should not wait too long. we should make sure that we use these effectively and that we get the optimal protection from these vaccines.
Professor, I really do appreciate the time. Thank you very much indeed. Professor Tiaan Dr Jager is, of course, speaking in his position as chair of the South African Deans of Medical Schools Committee, also head of the medical school at the University of Pretoria.